An editorial in this week's New Zealand Medical Journal has experts from the University of Otago and the Department of Psychological Medicine saying New Zealand's mental health workforce is on the brink of collapse. Associate Professor and Psychiatrist James Folds is one of the writers, and he joins us now. Associate Professor James Folds, welcome to the program. It's no secret New Zealand faces a health workforce crisis, and the mental health workforce situation is well documented. But what has been offered in the way of practical solutions?
Well, kia ora, Perepi. Thanks for having me on. So there is some stuff happening. There's been more funding for an increase in size in the workforce, and there's efforts to recruit people from overseas. But despite that, there's over 800 vacancies currently across our mental health system, and we have a rapidly ageing workforce.
Can you expand on the strain the system and staff are under?
So if you imagine that you're missing 10% of your workforce, it means that the rest of the staff have to pick up that work. People are taking on extra shifts. They're basically worn out. It's very difficult for the nurse managers having to staff the shifts. They're spending a lot of their time just having to ring around and find people to do the work.
Similar to the teachers as well. Is employing only clinicians with a tertiary level degree a luxury our mental health system can no longer afford?
So we've got these 800 vacancies. The reality is that we're not going to be able to find doctors, nurses, psychologists in the short term to fill those roles. So I think it's actually an opportunity to look at what our workforce should look like. And there may be some actually benefits that come from looking at who we have at the front lines.
The health workforce data show that Māori and Pacifica are more likely to be in a casual employment. Why is this problematic?
Well, it's problematic because if you're not on a long-term permanent contract, you've got less opportunities for training and advancement into leadership roles. And not only do we need more Māori in our workforce, we need those people in senior positions, leadership roles.
Couldn't some of these contract workers be employed as full-time employees?
So even if they are full-time, I think if you're not on a long-term contract, the employer is not investing in you and seeing you as someone that's part of their future workforce, so to speak.
So what directions should the sector be moving towards, in your opinion?
So I think we need to build opportunities for on-the-job training for people to lower the barriers to people coming into the mental health workforce so that people aren't having to go away and do a 3-year tertiary degree, racking up tens of thousands of dollars of debt. So we should bring them in, train them on the job, and especially for people with lived experience, Māori and Pacific people, those are some of the sorts of groups that we should be targeting.
So apart from the financial barriers, what other barriers are there?
In terms of finding people, I guess there's a perception currently of mental health work being difficult and under strain. And so we need to convince people of the value of that work and that by coming in, they can make a difference.
If people are recruited without a tertiary degree level health qualification, what other useful attributes should they have?
Well, I think people need to be able to work in teams, to be driven, willing to learn, and it's the social skills that they have, the ability to interact with tangata whaiora, those are the key attributes, not just the ability to have a lot of book knowledge.
So why is a deep understanding of tikanga Māori and Pacifica culture critical in this workforce?
So there's several reasons. The first reason is that among the people accessing secondary mental health services, just over a quarter are Māori, against about 14% of the workforce. So having more Māori in the workforce would allow it to match up with the breakdown of the people that's accessing the service. The other main reason is that having good knowledge of tikanga Māori, speaking as a non-Māori myself, I've seen how that can really help the outcomes for those whaiora. There's also other benefits when you've got more Māori with that specialised knowledge in the workforce. It benefits the non-Māori clinicians as well in terms of their learning. There's even spillover benefits in the way that non-Māori clinicians would practice with their clinicians who aren't Māori in terms of learning from the value of tikanga.
Kia ora. You also say retention efforts should be focused on women. Why is this?
So I think at the risk of sort of sounding like a dinosaur with sort of gender stereotypes in mind, the workforce is 2/3 women. And I think women still in this day have different roles to men outside the workforce, where they may be juggling roles within the whānau that are quite difficult to balance against work. And I think our workforce can be more responsive to the needs of women to allow them to get that balance right.
Well, thank you for speaking with us today. Really appreciate it. Associate Professor James Foltz. Tēnā koe.
Kia ora, Piripi. Appreciate it.